Meet Chris and his mother Susan. Chris has asthma and uses the ProAir HFA Quick Relief Inhaler when his symptoms flare up.
It was really important for Chris to learn how to use his inhaler the right way. Before Chris used his inhaler for the first time, he needed to prime it. To prime the inhaler, just spray into the air 3 times, away from your face. You'll need to prime the inhaler every time you get a new one or if you don't use it for 2 weeks. Before you take a dose, give your inhaler a good shake and breathe out as much air as you can. Put the mouthpiece in your mouth and push down on the canister. Now breathe in. Hold your breath for as long as you can, up to 10 seconds. And now that you're done taking your dose, make sure to put the cap back onto the inhaler mouthpiece. It's important to take the dose your doctor prescribes. Taking too much can increase the risk of side effects. Chris usually takes 2 sprays. Before he takes the second one though, he waits about a minute and then he gives the inhaler a shake. I also check to make sure that Chris's inhaler hasn't run out or expired. The expiration date is printed on the side of the canister, and the counter at the base of the inhaler tells me how many sprays are left. When you get to 20, the numbers turn red, meaning it's time to get a refill. When the counter gets to 0, it's time to stop using the inhaler, even if it feels like there's still medicine left in the canister. Replace your inhaler before you get to 0 or the expiration date, whichever comes first. Chris's doctor said to tell him if his symptoms ever got worse while using his inhaler. That could mean that his asthma is getting worse or that he's having a reaction to ProAir HFA. Either of these could be very serious.
Side effects associated with ProAir HFA have included headache, rapid heartbeat, pain, dizziness, and irritation of the throat and nose. You're encouraged to report negative side effects of prescription drugs to the FDA. Visit www.proairhfa.com/PI for full prescribing information or call 1-888-482-5922 to have a copy sent to you. Approved uses. ProAir HFA albuterol sulfate inhalation aerosol is indicated in patients 4 years of age and older for the treatment or prevention of bronchospasm with reversible obstructive airway disease and for the prevention of exercise-induced bronchospasm. Important safety information. If your symptoms become significantly worse when you use ProAir HFA albuterol sulfate, contact your doctor immediately. This may indicate either a worsening of your asthma or a reaction to the medication, which may rarely occur with the first use of a new canister of ProAir HFA. Either of these could be life-threatening. What to tell your doctor before using ProAir HFA. If you have a heart, blood, or seizure disorder, high blood pressure, diabetes, or an overactive thyroid, be sure to tell your doctor. Also, make sure your doctor knows all the medications you're taking, especially heart medications and drugs that treat depression, because some medications may interfere with how well your asthma medications work. Do not exceed the recommended dose. Side effects associated with ProAir HFA included headache, rapid heartbeat, pain, dizziness, and irritation of the throat and nose. You're encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088 to report negative side effects.